Hello everyone, I'm Dr. Swati Dubey and I'll be talking about acute pancreatitis. Acute pancreatitis is a very important clinical based question for your FMGE, INICET, NEET next. Okay, so without wasting any time, we'll continue with the topic and complete it in 15 to 20 minutes so that it is easy for you to revise it as fast as you can. Acute pancreatitis definition, it is the inflammation of the pancreas. You know, this is the pancreas, okay, the head of the pancreas, the insulin process, the body, the tail of the pancreas. So this is the pancreas, and the inflammation of this organ of the body, the pancreas, is known as pancreatitis. Okay, it could be acute, it could be more than few months. Okay, so chronic. Okay, so sorry. So causes of acute pancreatitis. Okay, the causes of acute pancreatitis will include. Just remember the two images which I have kept on this slide, and just put it in your mind. Okay, whenever someone will ask you what are the causes of acute pancreatitis, you will just have to remember that this image and this image are what I have to write about. Okay, the first one is a biliary image. Okay, so there will be a stone. Okay, you can see a biliary stone here. So, gallbladder stone is the most common cause for acute pancreatitis, and the second one is alcohol. You can see the man is so happy drinking alcohol, but the next day is going to have a severe pain abdomen and come to your emergency and eat your head with that pain. Okay, so just to remember about the causes of pancreatitis, we will have to give bad hits at the mnemonic. Okay, the alcohol give you bad hits. Okay, so alcohol gives you bad hits, so we'll make it a mnemonic so that it's easy for us to remember. So, what are the causes? We'll write about it. Okay. Bad hits include biliary. Biliary is the gallstone, which is the most common cause. Okay. Then the second most common cause is alcohol. Alcohol is the second most common cause, and autoimmune. Okay. There could be diseases like hereditary pancreatitis. Okay. It could be IgG4 antibody related. There could be pancreatic division, there could be periampullary mass, neoplasms, okay, which could lead to pancreatitis, autoimmune, okay. There could be some drugs like sulfonamides, okay. Then you can have 6-mercaptopurine, you can have azathioprine, estrogen, tetracycline, okay. All this can cause acute pancreatitis. Then you have high. H, you remember high. High is what? Triglyceride and your calcium. Okay, so high. How much triglyceride will, if it is more than 1,000, okay, milligram per deciliter, it can cause acute pancreatitis. Okay, and hypercalcemia also. Okay, this is very important. Hypertriglyceridemia and hypercalcemia can cause acute pancreatitis. Now, I includes, it could be infection like mumps, coccidiovirus, CMV, or parasites. Okay, this could cause your acute pancreatitis. Okay, other reason, if you don't get a reason, okay, you write etiology not known, right? So idiopathic. Okay, if they don't have gallbladder stone, they don't have any of these reasons, then you can write idiopathic. Okay, then it could be trauma during a surgery. Okay, or it could be post ERCP. Okay, it can cause pancreatitis. And the last one is a scorpion bite. Scorpion bite, there is a Trinidad scorpion, okay, the bite of which can cause acute pancreatitis. Okay, steroids I have already told you. Okay, so these are the causes of acute pancreatitis which we have to remember, and it's a very important question. Even if it comes in long question, you can explain these very well. Just remember the images. Now, what are the types of pancreatitis? Okay, the types of pancreatitis include interstitial pancreatitis and necrotizing pancreatitis. Okay, the interstitial pancreatitis will have blood supply maintained. Okay, the blood supply will be intact, but in necrotizing, necrosis is there. That means the blood supply is compromised blood supply. Okay, or it is interrupted. Okay, interrupted or compromised blood supply. Now, the pathogenesis. Okay, the phases of pancreatitis, there will be three phases of pancreatitis which will include your first, second, and third phases. The first phase, you will have two things. Okay, there will be pancreas have acinar cells. Okay, so there will be acinar cell injury and intrapancreatic interpancreatic enzymes which are there. They are digestive in nature. They will be activated. Okay, activation of intrapancreatic digestive enzymes and acinar cells injury. Okay, the second phase will have your activation, inflammation. Okay, inflammation have many steps, okay, one by one. Okay, so the same way there will be activation, chemo attraction, and sequestration of WBC and macrophages. Okay, sequestration of WBC and macrophage, which will all lead to increase intrapancreatic, which will all lead to increase intrapancreatic inflammatory reaction. Okay, the third phase will have, what will happens is interpancreatic inflammatory reactions are increased. Okay, so these which are inflamed, they will release certain proteolytic enzyme and cytokines, okay, which will be activated, and cytokines will be activated. Okay, you see, okay, when we do some blood reports and all, then we see that some cytokines are increased. That way they are just a marker of the inflammation. Okay, we'll be studying about some genes which are related to the acute pancreatitis. Okay, so there will be PRSS1 gene. This is the cationic trypsinogen gene. Among all the variants which are going to study, only PRSS1 mutations are sufficient to precipitate acute pancreatitis in the absence of risk factors. Okay, whereas the other variants are disease modifiers. Investigation of other variants are currently going on. So for us, this is the most important one. Then you have the cystic fibrosis transmembrane conductance regulator gene. Then you have the pancreatic secretory trypsin inhibitor gene. Okay, then you have the chymotrypsin C gene. After that, you have the calcium sensing receptor gene. Then you have the claudin 2 gene. Okay, among which one is very important is the PRSS1 gene, which is very important. Okay, now we'll talk about the diagnosis. The diagnosis of acute pancreatitis, we need to remember few points which are very important. How will the patient present to you with in the OPD? The patient will present to me in the OPD or the emergency. Most likely, emergency patients come. Okay, epigastric pain which will be radiating to the back. They will give you a very typical history that I have epigastric pain which is radiating to my back. Okay, and then when you go and send their lab reports, your amylase and lipase levels will be more than 3 times normal. Okay, now like the normal limit is 60. Okay, so it could be 1000 or it could be 800 or it could be 350. But does it depend that how severe it is depending on the value? No, you don't have to relate, you just have to check. If it is 3 times normal, up more than 3 times normal, you will use it as a diagnosis. Okay, but you don't have to use it as an index of severity. The third one which you will have is the imaging. Okay, you will do an ultrasound or you will do an CT scan to check if there is any pancreatitis, mild, acute, interstitial necrosis is there or not, everything. Okay, and out of this, if any 2 out of 3 is present, then it is diagnostic of acute pancreatitis. Okay, this is very important, you need to remember it. Okay, diagnostic of acute pancreatitis. Okay, now there are types of pancreatitis. Okay, types of pancreatitis will include mild, moderate, and severe. Mild pancreatitis, okay, there will be no local complications. Okay, no local complications. Okay, it is most likely interstitial was the blood supply was not being affected. Okay, it is most likely interstitial and it will be self limiting, it will take few days and it will be better. Okay, then moderately severe, there will be an transient, okay, for a few hours, okay, less than 48 hours. Okay, transient organ failure. Okay, or there will be local or systemic inflammation in absence of organ failure. Okay, and the third one which is moderate, which is severe will be, there will be organ failure which is persistent. Okay, it will stay for more than 48 hours. Okay, it could stay for either 1 week or 2 weeks also, it can pull up to. Okay, so depending on that. Okay, so necrosis, okay, you can assess only after 3 to 4 days. So best imaging now, Best imaging, what will we do? CECT whole abdomen. We'll use a contrast induced CT scan, okay? And this is 3 to 5 days in hospitalization. So that why? So necrosis and all you will see mostly after 3 to 4 days, okay? You can see it clearly. So we will do CECT. Till that we'll start the treatment because we are getting a clinical history and we know about it, okay? We are getting the mileage lipase values also. So most likely you will come to know about it. Now, what is the treatment? Treatment is, this is very critical, okay? IV fluid resuscitation. IV fluid resuscitation is critical. IV fluid resuscitation is critical, okay? This is very important to prevent any local or systemic complications from the secondary inflammatory responses. We have to give IV analgesics. IV analgesics is so important because patient comes with such a severe pain that even sometimes we have to give patches, okay, fentanyl patches and all, so that the pain is reduced, okay. Patient complains of very severe pain, okay. And then if there is any injury to the organs, like if there is lung injury, there is saturation decrease, then we can give supplemental oxygen. If there is any kidney injury or not, okay, supplemental oxygen. If there is we have to find the cause, okay. If there is gallstone, then we need to, if there is gallstone, we need to perform a cholecystectomy after our pancreatitis is reduced or improved. Or if there is hypertriglyceridemia, we have to start the treatment for triglyceridemia. If I'm using some gliptins or any other drug which is not given in patients of pancreatitis because it will aggravate it, so we will stop the drug and use another drugs, okay. If steroids are going on, we'll have to stop these steroids, okay. Likewise, the bad hits which I taught you, okay, these will have to be managed accordingly, okay. Thank you so much for bearing with me for so long. I hope you like my video. Please comment if any doubts are there, or if you want me to cover any topics, okay. I will try to cover it as soon as possible. Thank you so much.